Today's topic that I'm going to be discussing with you guys is prescription drug abuse. It is a rising issue in our society today, and it was a great topic to research. I learned a lot about the topic, so I hope you guys learn a lot, and I hope you guys enjoy my presentation. There are 3 factors in determining an individual's vulnerability to developing a substance use disorder. The 3 are genetic, environment, and psychological. Genetic, it's a development of an addiction that is influenced by multiple biological and familial, psychological, and socio-cultural factors. It only accounts for around half of the reason for a person to becoming an addict. In our societies, everyone has access to drugs and alcohol. Some people use them, and some people have become addicted. However, not all people who use substances will become addicted or dependent or even use them regularly. Similar upbringing, environmental factors, rate of abuse for a drug, and peer influence still do not mean that people will struggle with the drug addiction. There's also no one particular addiction gene, but a number of different genetic and biological factors that make someone more or less vulnerable to becoming an addict. Genetics are thought to contribute to the development of heavy substance use, although environmental and social factors are necessary to direct a person into the problem of an addiction. Genetic predisposition is considered important in developing a drug or alcohol abuse problem. It is suggested that individuals who have a parent or grandparent who has an addiction are going to be more vulnerable to addictions. This is not to say that people who are born into a family who have substance abuse problems will have the same problems as their family members. It simply means that they will be more susceptible to developing an addiction. They may find it harder to quit once they do become addicted, or have more severe withdrawal symptoms. Vulnerability to substance use is also influenced by demographic, environmental, behavioral, and personality factors. Poverty, previous sexual abuse, rebelliousness, delinquency, incarceration, and peer drug use are also issues that contribute to a person's vulnerability to substance abuse. Without these additional factors, it is assumed that a person will not develop a substance use problem even if they have a parent who has suffered with a chronic alcohol or drug abuse problem. The second one is environment. Environmental factors are factors that affect a specific group of people in a community. It's not just a specific person. The environment refers to the conditions in which an individual lives, their household, their neighborhood or town, the larger community. These may include aspects of social environment, including the norms and behaviors of their families, friends, or anyone else in their community. It also involves aspects of physical environment, including access to resources, exposure to hazard, and overall living conditions. Environmental factors fall into the following categories. The first one is support and services. Availability and continuity of social support and ties, such as with family, friends, neighbors, and those with different experiences. Availability of appropriate services, such as for basic and specialized needs. The second one is access, barriers, and opportunities. So physical access and barriers, including distance and physical access to services, communication access and barriers, including language spoken and access to interpreters if it's appropriate, competing requirements for participation, including things that make involvement difficult, such as having to work or caring for your children. And the third one is consequences of efforts, such as social approval and disapproval, such as whether a family and peers encourage or discourage particular behaviors. Incentives and disincentives, including monetary and material gain or loss, and likely prospects for getting desired benefits. The fourth one and last one is policies and living conditions. Policies such as those that affect who gets benefits, environmental enforcement of laws, workplace policies, eligibility requirements for services, financial barriers and resources, including not having enough money for needed goods and services, and how resources are allocated, exposure to hazards including toxic chemicals, air pollutants, or risky situations. The final one is psychological vulnerability. Stress has long been known to increase the vulnerability of an addiction. The last decade has led to a dramatic increase in understanding the underlying mechanisms for this association. Behavioral and neurobiological correlates are being identified, and some evidence of molecular and cellular changes associated with chronic stress and addiction has been identified. There are also some evidence that recent negative life events and physical and sexual abuse also exert somewhat independent risk on addiction and vulnerability. In addition to sexual abuse and physical abuse, negative effect and chronic distress states are predictive of addiction vulnerability. High emotional stress is also associated with loss of control over impulses and inability to inhibit inappropriate behaviors and to delay gratification. The next slide is planning interventions in prevention and treatment settings. Risk and protective behaviors are what I'm going to be talking about. They are key in figuring out how to address community health and development issues. It's a matter of taking a step back from the problem, looking at the behaviors and conditions that originally caused it, and then figuring out how to change those conditions. For example, in an effort to prevent substance abuse, an approach that uses risk and protective behaviors to direct interventions might give young people healthy activities in which to participate in, positive role models, the assertiveness training to be able to just say no when they are offered any kind of alcohol or drugs. Substance abuse prevention interventions are designed to help individuals develop the intentions and skills to act in a healthy manner. Other focus is on creating an environment that supports healthy behaviors. Research tells us that most effective prevention interventions are those that incorporate both these approaches. In other words, it's not enough to just convince a teenager that underage drinking is harmful or provide her with the skills to resist peer pressure. You also need to make it difficult for him to obtain the alcohol in the first place by training liquor store clerks to check identification and enforcing laws to penalize merchants who sell to underage individuals. Some risk factors are lack of attachment and nurturing by parents, ineffective parenting, and academic failure in association with drug-abusing friends. Some protective factors are a strong bond between the children and parents, strong parental involvement in a child's life, and clear limits and consistent enforcements of discipline. However, other groups are also vulnerable and at risk of being overlooked due to the lack of epidemiological data. Incarcerated criminal offenders are more likely to have abuse-controlled prescription drugs than the general, non-institutionalized population. Patients with acute or chronic pain are at greater risk of abusing opiate medications. People suffering from psychiatric or other health conditions or other disorders. Individuals who are currently dependent on alcohol or illicit drugs or have a history of substance abuse are also at an increased risk of using prescription drugs non-medically. The next topic is talking about cultural competence in assessment and treatment protocols. Culture must be considered in every single step of the strategic prevention framework in order for diverse populations to benefit from the selected interventions that have been chosen for them. While people often think of culture in terms of race and ethnicity, there are many other elements, some that are easy to see and others that are hidden. Cultural competence means being respectful and responsive to the health beliefs, practice, and cultural and linguistic needs of diverse population groups. Lastly, developing cultural competence is an evolving, dynamic process that takes time, and occurs along a continuum. Screening questions should be asked in a confidential setting and in a non-threatening, non-judgmental manner. Many older adults are acutely sensitive to the stigma associated with alcohol and drug abuse, and far more willing to accept a medical as opposed to psychological or mental health diagnosis as an explanation for their problems. Prefacing questions with a link to a medical condition can make them more palatable. For example, I'm wondering if alcohol may be the reason why your diabetes isn't responding as it should, or sometimes one prescription drug can affect how well another medication is working. Let's go over the drugs you're taking and see if we can figure this problem out. It is vitally important to avoid using stigmatizing terms such as alcoholic or drug abuser during these encounters. Screening and assessment must be approached with a perspective that affirms cultural relevance and strengths. An understanding of the cultural basis of clients' health beliefs, illness behaviors, and attitudes towards and acceptance of treatment provides a foundation for building a successful treatment program for the client. Whenever possible, instruments that have been normed, adapted, or tested on a specific culture and linguistic group should be used. Instruments that are not normed for the population being evaluated can contain cultural biases and produce misleading results and perhaps inappropriate treatment plans and misunderstanding with the clients. Screening for substance use disorders is conducted by an interview or giving short written questionnaires. While the selection of the instrument may be based on various factors, including cost and administration time, the decision to use an interview versus a self-administered screening tool should be based upon the comfort level of the counselor or healthcare professionals. If a healthcare staff communicates discomfort to an individual, they may become wary of disclosing any kind of substances that they are using. The next slide, we're going to talk about skills that are needed for social workers and the roles that they take in prescription drug abuse counseling. So, social workers can drastically improve treatment services for clients and their families by developing and applying evidence-informed approaches to incorporate established interventions and evolving techniques based on emerging research findings. This approach to service delivery requires that social workers need be knowledgeable about the process and dynamics of substance abuse, including abuse, dependency, and recovery. Social workers also need to have knowledge and ability to work with clients to develop an effective treatment plan using existing and emerging resources, including evidence-informed practices. To meet the needs of the clients with substance use disorders, social workers must remain current regarding the frequent changes in legislation, regulations, and third-party requirements like the Affordable Care Act and HIPAA regulations. Okay. The next slide is ethical and legal issues in prevention and treatment. One of the most dominant ethical dilemmas is autonomy versus beneficence. This surfaces regularly in professional practices with a variety of vulnerable populations and across numerous healthcare and community-based settings. Helping professionals often act out of beneficence or an obligation to help clients for their greater welfare. Professionals who act beneficently place clients' best interests above their own interests. In contrast, autonomy is defined as self-rule or the ability to freely make and act on decisions without coercion or outside interference. Professionals are not obligated to act beneficently or in the client's best interest, but they are charged with respecting clients' self-determination or autonomy. The confidentiality example is the Affordable Care Act expands treatment to family members. For years, addiction providers emphasized how important family treatment is to the whole family system. However, few programs have been able to implement consistent and integrated family programs. While integrating families, this will improve outcomes. The expected growth of family treatment will push up against confidentiality boundaries, unfortunately. The issues of how and what to share with the primary client and patient's progress, along with how much to share from the family members and the primary client and patient. This needs to be resolved. Training in ethics and confidentiality will become a higher priority to reduce perceived trust issues and potential malpractice claims. Informed consent. Off-label prescriptions are often those that do not comply with the FDA-approved use for the drug. While they are legal and account for roughly half of all prescriptions written today, often they are not supported by sound scientific evidence. In addition, they have the potential to drive up the cost of healthcare and expose patients to unnecessary risk and uncertain outcomes. Legal and ethical principles require physicians to inform patients about risk and medical treatments. We propose that the doctrine of informed consent be rigorously applied to require doctors to disclose to patients when they are prescribing a drug off-label, providing full disclosure to clients, and encourage them to share in decision-making in situations of medical uncertainty is vital to respecting their autonomy. While laws and policies in other countries may differ, the U.S. today's legal standards require physicians to obtain informed consent from a person before performing a test or starting a treatment, particularly a treatment that involves some uncertainty. The doctrine of informed consent reflects that value we place on patient autonomy. Until the early 20th century, doctors were not required to inform their patients about the risk and alternatives to a proposed treatment. The assumption was that doctors knew what was best for their patients and that patients were sufficiently protected by their doctors' interests in their well-being. Over time, as patients asserted greater autonomy rights, the law evolved to impose a duty on doctors to make those disclosures which a reasonable medical practitioner would make under the same or similar circumstances. Some later cases took patients' autonomy a step further by refocusing the analysis on the information that the patient would want to know rather than on the information the doctor would customarily disclose. According to the doctrine of informed consent, the doctor is required to disclose the nature of an intervention, pros and cons of intervention, alternatives to intervention, pros and cons of alternatives. This is where the informed consent doctrine stands today. Some states use the reasonable doctor standard, while others use the reasonable patient standard. Under either approach, the law recognizes a therapeutic privilege when full disclosure would be determined to a patient's total care and best interest. The next topic is stigmas. So the saying, "Don't judge a person until you walk a mile in their shoes," is an excellent way to keep from giving into a stigma. However, not everyone is going to be able to relate to a person with a prescription drug abuse problem. They need to encourage opinions to be formed from an outsider's point of view. The opinions can easily be shared by others, creating many stigmas pertaining to this form of addiction. I'm going to talk about choice, deal and steal, and compassion. Choice. Well, it has been proven that addictions is developed as a result of 50% of the environment and 50% of genetics. Some people just don't see it that way and have difficulties relating. Because they don't have the urge to use excessively, they feel though they are choosing not to use, when this is not the case at all. For those who have the urges, it is due to the 50-50 rule, making it nearly impossible to not use. They are not actively choosing to be an addict. Deal and steal. Not all addictions are like the ones seen in movies, meaning that not every prescription pill user is a dealer or a thief. Some of the most common ways that people continually abuse prescriptions is either by finding them in their homes or being prescribed to them by a doctor. People no longer need to meet up on the street corner or steal them from other people's homes to obtain drugs, as they are no longer difficult to obtain in the comfort of their own home or at the doctor's office. And compassion. A major part of prescription drug stigma is that people on the outside looking in think that those who are using don't care for anyone but themselves. This is highly untrue. The addiction is stronger than almost anything, and making it seem that friends, family, and children are unimportant. Along with these stigmas, people also tend to view prescription drug users as being poor, homeless, and overall dishonest people. While in some cases the stigma might ring true, overall the population of prescription drug abusers are just like everyone else, except they have a dependency issue. Their prescription drug abuse does not make them a bad person, it just provides them with a serious obstacle that they need to overcome to find their sobriety and health once again. Given the extensive social stigma and common misperceptions related to prescription drug abuse, diagnoses and other treatments can affect a client's professional status, social standing, and livelihood. Substance use disorders can significantly disrupt a client's family system. Substance use disorders are often treated as a moral and criminal issue rather than a health concern. Healthcare providers may hold negative beliefs about people with substance use disorders, including that they overuse system resources and are not vested in their own health, abuse the system through drug seeking, and diversion and failure to adhere to recommended care. Such perceptions can contribute to inequitable and poor provision of care for people with these disorders. As such, individuals with prescription abuse issues may choose to conceal their substance use problems and in order to avoid stigma, which may result in care provision that does not attend to substance use related needs. Everyday prejudice creates a host of obstacles for recovering drug users. Offers of work or housing are commonly withdrawn when it becomes known that the recipient has a serious drug problem, even if they had stopped using. Yet, employment and stable accommodations are two of the most important factors for helping people overcome dependence and stay off drugs. Anything that makes these harder to access will worsen the drug problem. The next topic is historical trends and perspectives, policy, and funding. According to the social control theory, strong bonds with family, friends, school, work, religion, and other aspects of traditional society motivates individuals to engage in responsible behavior and refrain from substances and other deviant pursuits. These bonds encompass monitoring or supervision and directing behavior towards acceptable goals and pursuits. When such social bonds are weak and absent, individuals are less likely to adhere to conventional standards and to tend to engage in undesirable behaviors such as misuse of alcohol and drugs. The main cause of weak attachments to existing and social standards is inadequate monitoring and shaping of behavior, including families that lack cohesion and structure, friends who espouse deviant values and engage in disruptive behaviors, and lack of supervision and vigilance in school and work. Behavior choice theory. This is closely related to social control perspective, but it focuses specifically on involvement in protective activities. In this theory, the key element of the social context is the alternative rewards provided by activities other than substance use. These rewards can protect individuals from exposure to substances and opportunities to use them, as well as the escalating and maintaining substance use. The theory says that the choice of one rewarding behavior, such as substance use, depends in part on lack of effective access to alternative rewards through involvement in school and work pursuits, religious engagement, and participation in physical activity. For example, physical activity and substance use may both elevate mood and decrease anxiety, which would make which may make them functionally similar and substitutable. The next one is social learning theory. This says that substance use originates in the substance-specific attitudes and behaviors of the adults and peers who serve as an individual's role model. Modeling effects begin with observation and imitation of substance-specific behaviors. It continues with social reinforcement for and expectations of positive consequences from substance use, and culminates in substance use and misuse. In essence, this theory proposes that substance use is a function of positive norms and expectations about substances and family members and friends who engage in and model substance use. The last theory is stress and coping theory, which says that stressful-like circumstances comes from family members, friends, school, and work, and leads to distress and alienation and eventually to substance misuse. For example, the work stressor model suggests that employee substance use is a response to problems in the workplace, such as the employee interpersonal conflict with supervisor and coworkers, unfair treatment, meaningless and low work level, high work demands, and a lack of participation in decision making. Stressors are most likely to impel substance use among individuals who lack self-confidence and coping skills, and who try to avoid facing problematic situations and escape from experiencing distress and alienation. So, trends with this population. This was a trend that was from the past decade. The percentage of Americans who used at least one prescription drug in the past month increased from 44% in between 2000 to 2007 to 48% between 2007 and 2012. The percentage of a person who used 2 or more prescription drugs increased from 25 in 2000 to 2007 to 31% in 2007 to 2012. The percentage of people who used 5 or more prescription drugs increased from 6% in 2000 to 2007 to 11% in 2007 and 2012. So there's obviously a prescription drug abuse issue in America, and it needs to be attended to. Policy, I found an example from that included the United Kingdom and the United States. We draw to scientific literature and our public policy experiences in the United Kingdom and the United States to give an overview of the policies which may improve care for individuals with substance use disorders. We divide the policies into process-focused quality improvement strategies that attempts to change some aspect of treatment, including increased retention, greater use of evidence-based practice, and the next one is patient-focused strategies. That attempt is to award outcomes directly. For example, contingency management for our patients, payments by results for providers. The findings is that many policies of both of these two types are poorly developed and have shown poor results, or both. The evidence is clear that process-focused quality improves the strategies, and they can change what providers do and how treatment programs work, but changes have far demonstrated only minimal impact on patient outcomes. Patient-focused strategies face challenges, including treatment providers avoiding hard-to-treat patients or spending inordinate time relocating patients after treatment to assess outcomes. However, policies that reward in treatment outcomes and policies that have the patient to purchase desired recovery support services show more promise. As policymakers go forward in this endeavor, they can do an enormous service to their countries and the field by embedding careful evaluation studies along new treatment outcome improvement initiatives. And funding. The Substance Abuse and Mental Health Services Administration, SAMHSA, administers substance abuse prevention and treatment block grant programs. It is a major source of funding for substance abuse treatment services and is therefore a vital resource for a subpopulation of individuals who are at a higher risk of homelessness. According to the analyses done by SAMHSA on state outcomes, 10% of those admitted to publicly funded treatment programs are experiencing homelessness at time of admission, and substance abuse can make it very difficult for individuals to maintain housing stability. The funding services as a key resource are substance abuse treatment for low-income individuals. The last topic is empowerment. This approach for prescription drug abuse treatment is definitely an empowerment-based approach. This treatment teaches individuals to learn and recognize their triggers to prescription drugs. This also includes situations that they are in or places that they go. Through counseling, triggers are sought out and the individuals are given assistance to dealing with each trigger. They also are taught coping skills to replace drug-taking behaviors. Each treatment is customized for each individual. So once detox and rehab is over, the individuals are encouraged to continue with support groups, and if they need, they can continue with a therapist and can even include their family members in treatment or in counseling. Treatment also enhances and maintains motivation to abstain, problem solving with managing thoughts, feelings, and behaviors, and lifestyle balances. Viewing the client as part of a larger system while providing individualized treatment as appropriate is a mainstay of delivery of effective services and empowerment. Social work practice encompasses a supportive approach and is aligned with the core values of social work profession. Social work practice values the importance of education and early intervention and prevention of prescription drug abuse.